vendors that help support our industry. And we wanted to understand a little bit more about how these companies, whether they're in training, whether they're in IT infrastructure, whether they're in different sectors of the healthcare. We even have clinical research here with us. How they see the industry or their industries evolving and developing post ECQ or post GCQ. How they see the new normal and what they're doing to help us in our industry, not only healthcare BPO, but even healthcare in general. Restart, do better, all understanding that the normal we used to have back in January, February will not be the same, at least for the near future, because we don't have a vaccine yet, and there's so many things that are happening. So I wanted to just preface this conversation today to really understand how we are all preparing for post ECQ, post GCQ. Admittedly, different companies are preparing different things, and we've allocated a lot of time today. We have 90 minutes for this meeting, so I hope we have a very good conversation. Also wanted to share with you, for everyone on the call, I think we are the country with the longest lockdown ever. So I think we've pushed more than 8 weeks. Other countries have done less. And I think we're one of those with the longest lockdowns ever. So hopefully we'll see the benefits of that, and I hope we don't get a second wave in our country, in the Philippines. So I thought I'd just everything we're doing is a big sacrifice that everyone's doing. I hope it will not all go to waste, and that we're able to restart our businesses and eventually restart the economy so that we can all get back to our course of business as we go along. So on that note, thank you for the opportunity to open, and thank you for having you with us on this session today. I'd like to turn it over now to Raymond Ang. Raymond is a board of trustee of HIMAP, Health Information Management Association of the Philippines, and he's also the founder and CEO of Edelinks Corporation. So Raymond, over to you. Yeah.
Yes, thank you, Roger. Good afternoon, everyone, and welcome to today's webinar session. Considering the current situation and the new normal that is slowly but surely taking shape, we have, as today's resource speakers, 3 experts from very important fields that affect our industry. Through our conversation today, we hope to find answers to some of the nagging questions regarding our future in the industry and how we can better respond and take positive action in our respective areas of responsibility. Thus, we would like to welcome our 3 panelists. First is Mr. Rodmar Pulido. Rodmar is currently the president of the Philippine Clinical Research Professionals, Inc., and the general manager of PVOT, a contract research organization. He later transitioned into business development and operations management. Rodmar is a strong advocate of making the country a top destination for pharma companies in the conduct of trials. He graduated with a degree in microbiology from UST. Our second panelist is Mr. Victor Aliwalas, and Victor is currently the Vice President and Head of the Customer Relationship Management Group, handling the BPO industry for PLDT, specifically the Alpha Group. And he is a seasoned sales professional with experience in a wide variety of industry verticals, including mortgage banking, financial services, publishing, software, IT, and BPO. And our third panelist is Ms. Shama Siddiqui. Shama is currently the Senior Manager of L&D and Healthcare Solutions for TDS Global Solutions. She has an MA degree from Ateneo de Manila University and is supporting her organization transition into the new normal. She's also certified Six Sigma Black Belter and currently pursuing PMP certification. Now, as our speakers come from rather diverse fields, I will zero in and spend a lengthier time on each so that we won't have to jump from one topic to the other and get that thought together. So let's start with Mr. Rodmar Pulido. Rodmar?
Okay. Thank you. Thank you, sir.
Yeah, I think in terms of an initial thought, maybe you could address, this particular question, no? And then we carry on with the dialogue. Rodmar, the phrase flattening the curve has been around practically since day one of the pandemic or quarantine as a primary goal. And it appears we haven't achieved this.
Mm-hmm.
What is your organization's position on why and how this is the case?
Oh, okay. I'm afraid our organization is more on the conduct of clinical trials. We're more specialized into that area.
Right.
In terms of flattening the curve, that's a public health endeavor, and I'm afraid that's not within our purview. So, but in our opinion, since we're on the health sector and in that aspect, first, flattening the curve should be coupled with mass testing to be able to get a feel of how the population is in terms of COVID infections, and to be able to do what the classic public health measures, which is contact tracing and social distancing. The WHO has been aggressively promoting these classic measures. It's classic measures because social distancing and contact tracing has been practiced since the flu epidemic in World War II, and has been very successful in flattening the curve in that aspect.
Okay. All right. Thank you. Thank you, Rodmar. Would you be able to give us an idea of what PCRP is basically all about? So let's go back to fundamentals and basics. No?
Okay. All right.
What you guys are doing and how you are actually a integral part of the healthcare industry as we speak.
Okay. So first of all, we're an organization of professionals that are mainly involved in the management of clinical trials. We do not conduct clinical trials ourselves, but we manage them for pharma companies. Majority of us are in the front-facing part, which is the management part, but very few of our members are into the data processing and data analytics part. So in relation to COVID, one of our in the early days of this pandemic in March, for example, one of our advocacies is for Philippines to be able to get COVID trials that are happening in globally, and we have been continuously liaising with the FDA and hospitals in getting a feel of what are the measures that they've been doing in terms of getting COVID trials. As you can see, it's a competition among countries to get these trials globally. So one of the biggest factors that pharma companies will decide in selecting a country for a COVID trial, for example, would be how fast would that country initiate such studies. Malaysia, for example, the government of Malaysia has formally declared that they can start COVID trials in less than 15 days. Thailand can start COVID trials in less than a month. We do not have such documentation for the Philippines that we can give to our clients to be able to win them over. So our organization has been in contact with writing to DOH, writing to FDA, liaising with hospitals so that we can give the decision makers a better picture and make the Philippines more attractive. Yes. So that's something that we've been doing in relation to COVID trials. In the other aspects, in terms of the trials that are ongoing, we have released guidance measures, contingencies in how these trials should be operating in relation to the pandemic. So
okay.
Yeah. Yes.
Go ahead, Roma. Yes. No, I was just saying that
Mm.
most probably if their clients are U.S.-based European companies that outsource some of the work of the trials over here.
Yes. To give you a picture,
Okay.
if you're just zeroing on COVID, there are currently, as of
Mhm.
May 12, there are like 87 trials under different phases. Coming from, I'm sorry. There are, I'm sorry, there are 21 trials under COVID globally that are in different phases. None of them are in the Philippines so far. And hopefully we can get at least one or two or several of these trials. There are like 10 companies involved in those 21 trials. Some of those trials are into vaccines. Some of those trials are into antivirals. So hopefully we can get those trials. All of them are based in Europe, in US, and in Northern Asia, in I think China, Japan, and Korea. Yes.
I understand. Okay. Um, I was also thinking that do you see more use of technology and other advanced tools? While we speak
Uh-huh.
about clinical research, there's automation, analytics, and AI
Yes.
coming into play. Would
Yes.
this be something that would also impact clinical research as a result, of these technology, and perhaps as a result of the new normal?
Okay, that's basically the new normal. So the future of trials, it's a future that has been discussed for several years already, and it's a future that will be necessary. So in conjunction to what you're saying, one of the major things that we see in the future or would be the use of digital technologies for in trial conduct. Examples of these technologies would be wearables, wherein wearables to capture patient data. The other is to use artificial intelligence to manage trials, to look at quality of trials that are coming from, say, 100 hospitals globally, and how can quality be managed? How can data be captured and used? Should the trial stop, for example, early stage? Should the trial continue? Are there safety concerns wherein make a decision whether you want to continue or to stop? These things require artificial intelligence. Plus, of course, the artificial intelligence that's required in analyzing the data. Um, Together with the use of wearables, we would see a future wherein it's a norm already in advanced countries, but in the Philippines it's still a huge challenge. We would want to see hospitals embracing EMR. So fully embracing EMR. Right now, EMR systems in the hospitals are not 100%. Very few hospitals are in the EMR 100%. So we would want to see full EMR, and trials can integrate into those EMRs in terms of capturing data. The other is uh, the use of remote technologies to do remote assessments. When I say remote assessments, technologies that would enable doctors to remotely assess patients when they're not in hospital premises. So these are telemedicine, for example.
Mhm.
And the other thing is to be able to bring trials at home. Trials nowadays are more in hospitals, and there's a concern now. There's a move now towards not having the patient visit hospitals, but rather bringing the trials towards their place of residence. For example, giving medications at the place of residence rather than giving the medication in the hospital. So technology it will play a lot of role in the new normal, and hopefully companies under HIMAP can contribute to the global market. Yes, for this opportunity.
Okay, Ron, how do you envisage an organization or association like HIMAP to be able to contribute more into the work that you folks are doing at the
Mm.
PCRP?
Okay, contribution can come from okay, one of the challenges in the Philippines is that we have very few companies that do develop drugs from scratch. Practically we have no innovators. We have a good herbal herbal industry, but none of the herbal industries would want to transition towards making their herbal products into drugs. The other is we have a very low research output, but we do have a research output. And if in case that these companies locally, whether they're in the academic setting or a pharma company, would do research, they would need to transition into electronic systems to gather data, to process data, to manage their studies. Unfortunately, electronic systems that the global pharma companies use are very, very expensive. So I think companies, local companies, can cater to the needs of the academics doing research, or to any pharma who would want to local pharma who would want to venture into drug research. In the big market, in the global market, there's a possibility, there are opportunities to penetrate into data analytics, the use of electronic data capture systems, the use of data analytics to analyze data, the use of systems to analyze project management systems, rather, the second, the use of wearables, technologies. Wearables can be simple, the watches, that's examples, and you can have technologies like imaging technologies, for example, that can be analyzed. You have ECG machines, that's an example. So ECG machines can capture data in the hospital and sent electronically directly towards the trial database. So these are the technologies that are being focused right now for clinical trials. So in essence, the local companies here can capture perhaps some of that market. So we see a lot of, there are companies here, although very few, wherein the data analytics for trials are actually in the Philippines. There's one or two companies that are doing that. And if we can convince global pharma to have their analytics here in the Philippines, why not? And the other is the use of apps. The use of apps will be increasingly important in getting patient data, in ensuring that patients can participate freely in many forms of studies, not simply drug trials, but trials that not simply drug trials, but research, medical research, wherein the data captured is simply on what patients are experiencing about their disease. So these are going to be very, very important.
Thank you, Rodmer. I think that kind of puts what you folks are doing, in context, so that we can form more questions and answers later, during that particular section. Just want our listeners to actually have a full perspective of what the PCRP is all about. So we will circle back to you in a short while we talk to Victor, about his expertise in the telco business. Victor, are you in right now?
Hi, Raymond. Can you hear me? Hear me okay?
Yes, loud and clear. Okay, so as a kickoff, if you don't mind, my addressing, a question over to you, so that we can get the discussions going. Victor, how has PLDT responded to the needs of business, given the imposition of quarantine measures across the Philippines? And basically what we're doing is, jumping into the ECQ and the post-ECQ. So I'd like to have a perspective on that. And also with the sudden surge of demand brought about by the ECQ, what has PLDT been able to do to support WFH arrangements for the BPO industry? And having said that, I think work from home is going to be a very important, part of the equation in the long run. Okay, so you've got the floor, Victor. Go ahead, please.
All right. First off, I want to thank Judy and Roger for inviting me today. There's a lot to be discussed, and we also want to thank the industry for all that you guys have done throughout, well, pre-COVID and post-COVID going to the new norm. It's definitely been quite difficult for everybody considering everything that's been going on. So from a telco PLDT perspective, our goal was really to establish kind of a day zero initiative. So day zero meaning once ECQ is ended, once everybody's back to their quote unquote normal state. But really for the IT BPM BPO segment, day zero really started as soon as the ECQ hit. So on our day zero, first and foremost, our main goal was to get everybody connected and maintain their operations as much as possible. So we were understanding that from a industry perspective, there was a study that was done by IBPAP as well as PLDT internally with our own clients. And we found out that roughly 66% were running fully operational. So 50% were working from home. Roughly 25% were stopped working completely. And the rest were working skeletal workforces, socially distancing within the office. And it's crazy to think some of the new costs and logistics issues that our clients had faced because of the skeletal working conditions. So you guys are putting up a lot of your employees in hotels, and the amount it costs to send the equipment, the work from home equipment, to the last mile destination of the agents' houses. So it was a big scramble for everybody. And we kind of did a survey to get all the insights. And the main thing that we learned is that the bandwidth requirements from home was at minimum 15 Mbps for companies that weren't working on anything voice related, and at least 20 for voice related lines of business. The captive BPO seemed to have been doing quite well, running at 90+% fully operational work from home. And it was interesting to hear that post-COVID plans, a lot of our clients were looking to go at least 30 to 50% permanently work from home after ECQ has ended. So it went from BCP going to BAU, right? And we were just doing whatever we could to help transition, whether it be our wireless services or our fixed line business. But after really understanding that this scenario is going to be so much longer than expected, we really recommend that the work from home setup have the fixed lines of business services from PLDT.
Perfect. Thank you, Victor. I think you guys have done a good job in terms of responding to a very short time frame, and I think PLDT continues to support the BPO industry very heavily. So
we can, and the four main issues that we heard from our clients. One is obviously the job security, health, and physical safety of the employees. The work from home connectivity as well, monitoring the productivity and the security of the agents that are working from home, and then obviously cost management and savings. So we've customized a lot of work from home plans, changing the lock-in periods to adjust to our clients' needs, so we can customize to that. And then in terms of monitoring the productivity, we're leveraging our partnership with Cisco Meraki and utilizing their platform, so you guys can monitor and maintain and see what exactly your agents are doing while they're working from home. And then obviously in terms of cybersecurity, we've partnered up with several different companies, and we're offering free trials with our endpoint security systems. So it's really addressing those initially. Now, I know I say this, everybody understands that aside from just the telco aspect of things, we at PLDT, we want to provide all our IT BPM BPO customers with essentially every service they need aside from the construction or the furniture in your office. But the main priority at this point is really the connectivity and cybersecurity for your work from home agents. And then once that's been established and that's been quite normalized, we'd love to work with you again and see how your operations is changing post-COVID, especially with issues from training to recruitment, because that's all going to change. We have to help everybody digitize. So our ears are on the ground. We're sending out a lot of surveys. So feel free to reach out to us. Let us know what you need in case we haven't covered it yet. And we'd be happy to put together solutions specific for the industry.
Perfect. Thank you. Having said that, is there any support from PLDT, cost-wise or bandwidth-wise, that you may extend as assistance to users, both individual and corporate, during and beyond this time of crisis?
Oh, yes, absolutely. So in regards to some of the wireless plans we have, as well as the fixed home enterprise packages that we've come up with, we've definitely taken into consideration the price points. Because again, our goal is to support the industry. You guys deliver what, 26.3 billion annually to the country every year. We don't want to see your clients leaving the Philippines, going onshore, going near shore. So we have to do whatever we can to maintain, one, our connectivity, two, our competitive price points, to ensure that you guys continue giving good services to your clients abroad. So taking that into consideration, we've changed some of the one-time expenses. We've changed the lock-in periods, and we've customized it based on what we're hearing on the ground from what our clients need. So we're absolutely willing to work with you. Again, we want to maintain that global competitiveness level. We understand, I think the Philippines is what, 12% revenues, 20% in headcount globally for the industry. So again, whatever we can do, even if it's costs, if it's technology, we'll try to accommodate.
There's been a lot of talks, about the BPO industry in the Philippines strengthening because of this pandemic, or as a result of the pandemic. From your perspective, looking into the near future, do you think that the industry will be growing because of what happened vis-a-vis our share in worldwide BPO or outsourcing business?
Mm-hmm.
Can you kind of give us an idea of what's happening from your standpoint?
Yeah, absolutely, Raymond. I appreciate the question. I think pre-COVID, the estimated potential for our industry was, I think the revenue growth was about 7.5%, headcount growth of 7% per annum. And that was for 2020 and 2022, or 2022. Now, can we still do that? I'm confident that if we all work together, we can. Sectors such as healthcare, animation, and game development, they were all expected to grow faster than the others. Now, we've been hearing on the ground from some of our clients, especially in healthcare lines of business, that some of their clients have suspended operations due to lack of patients in hospitals for non-COVID related procedures. Some people, they want to avoid going there for elective surgery or cancer treatment for now. So there could be a decrease in that regard to the aspect of the business. But on the other hand, there's been a spike in activities for lines of business servicing retail, industry, e-commerce, and the likes, because of what's going on with COVID. So there are ups and downs. Unfortunately, this time we don't have enough data to really determine how the industry will potentially end this 2020. But if it's proportionate to what operating capacity is at, based on IBPAP surveys, around 73%, then we can expect at least a 27% decrease in revenues. But again, there's so many variables to take into play. if the aftermath of the global financial crisis of '08 and '09 is any indication of what may result after things are settled with the pandemic, then we can be optimistic that the sector will grow based on what happened before. Because Raymond, these recessions can be a catalyst for all these big multinational companies in the U.S. They're obviously going to want to seek cost-cutting options for their organizations, and that'll always bring them back to that outsourcing option. And here in the Philippines, so the climate after COVID for lots of industry verticals will cause a decline in revenue. So I'm sure they'll be aggressive to outsource and save money. So at least that's a light at the end of the tunnel for us. I hope that making sense. I did prepare.
That makes sense. Thanks a lot. Thanks a lot for sharing. Because you'd have probably a better perspective, from your end. But that's good. That's good to hear. Now, one last thing before we circle back to you. This is kind of a hard question, but I might as well ask you since we're talking about the healthcare industry. So the healthcare sector is bound to grow as a result of COVID-19. Healthcare delivery will change together with customer needs as a result of social distancing measures and all of that. Beyond increasing bandwidth and improving coverage throughout the country, what is PLDT doing to meet customer needs and take the experience to the next level?
Well, every year, and you can see that from our press release and our investor PDFs that we send out. We're spending billions and billions of pesos annually to really revamp, upgrade, maintain, and sustain the broad infrastructure that we have here in the Philippines. Again, it's very difficult. I know there are areas of improvement, and we're always working to do our best to do so. One of the major things that we did recently within the year, I believe it was April. Now all of our 3G was upgraded to LTE. We're continuously rolling out fiber to the provincial areas, the next wave cities that you guys have identified that we need to be in. So that's really the goal, is just continuous investment, keeping our ears on the ground where you guys want to go. Within the past year, we've had some fantastic movements in the areas of Bohol because of more IT BPM companies moving in that area, and it's really working together with you to understand where we need to be and what we need to do. So it's continuous investments, putting more money into it, upgrading the infrastructure, and rolling out more fiber. And what we can do is, in the event that your IT BPM companies are interested in the work from home, we sign an NDA. We ask you guys to send us the addresses and names of the employees that you want to put on work from home. Our PM team will do a verification feasibility study on those addresses based on a latitude and longitude that we get from the addresses, and then we'll give you a feasibility report. And from there, we'll tell you, okay, great, we have good infrastructure here, things are running well, we can recommend our fiber for you guys here. If not, we highly suggest that our LTE services bundled with our SOHO broadband routers will suffice in this area. So I highly recommend that if you guys haven't implemented your work from home solutions yet, you have to jump on the board, because one, stocks have been an issue, as you can imagine, from the 1,300 plus companies in the IT BPM sector. Everybody's been clamoring for these routers, these pocket Wi-Fis, SIMs. And then from the fixed line work from home perspective, there's been a huge rush to get your agents and your employees provisioned and installed. And it's been a challenge just because of the ECQ, but we're prepared. I mean, we do have the government pass to work from an enterprise perspective as we're supporting the essential BPO industry. But again, you have to work with us because some of the difficulties that we run into is communications from the companies and the agents in scheduling the install. Sometimes our field reps will be there and then the agents are confused about the package. So it's really a partnership, and it really takes teamwork from all ends to make it work well. But I mean, one of our clients, we were able to provision more than 500 work from home agents, and this is fixed line within a month's time. So we're really proud about that, despite what's been going on. And keep in mind, this wasn't in Metro Manila. These are all over the provincial areas as well.
Victor, as you know, we speak about the work from home arrangements. I've gotten a couple of questions just right now. So I'd like to continue on the conversation. You mentioned
Really?
about
You're putting me on the spot, buddy.
Victor, no, very simple questions. You mentioned about consumption of 15 Mbps, from home, but there's a question here about voice-intensive operations, and they want to know what the minimum bandwidth is, on a WFH arrangement.
Yes,
For voice, more on the CCAP clients. Is there a higher requirement?
Based on our clients' requirements and kind of the averaging out that we're doing, majority of the voice are getting at least 20 to 25 minimum bandwidth.
Okay. Mm-hmm.
Yeah, and then for any chat or application tools, that's non-voice, you're looking at about 15.
Okay.
Yeah. So that's what we've been getting the most from our
Okay, that's good. That is one other question is current utilization of PLDT capacity in delivering bandwidth for work from home arrangements. Would you have that capacity going forward in terms of more demand, in this modality?
Yes, absolutely. We're more than prepared. And if you think about it, think about all the capacity that was going to, straight to the offices before, or retail, or whatever's closed. Even if they go back to normal, also we can still accommodate. There's plenty of bandwidth capacity with our infrastructure in the Philippines. Which
means that there's an increase in the establishment of sales sites around the country?
That's correct. That's part of the infrastructure upgrades that I mentioned before. I believe last year we were at around 60 billion in CapEx. So again, adding more cell sites nationwide.
Okay. Well, one last item. Okay, before we get to the next panelist. There's a question about PLDT. Are you providing some reprieve, given the bandwidth at the office sites that are significantly underutilized right now?
My recommendation is whatever company you're representing, please get in touch with myself or the relationship manager handling your account, and we can discuss that.
Perfect. Thank you so much. Okay, so we're going to be circling back to you, Vic. Thanks so much for your time. We now go to our only Rose among the panelists, right? So, Shama, are you ready?
Oh yes, Raymond, I am.
Okay. Sorry about that, but we were going into chronological, discussion. Okay, so now, from your expertise, you're with the TDS and the learning and development team. Now, the current quarantine has forced many of us to embrace technology and use digital means to conduct our work. That includes training and recruitment. How has this experience been for you, your L&D and recruitment teams? And where do you see the challenges and opportunities? Give a shot, Shama.
Sure. Thank you, Raymond. And that's a really great question. It's, I think, something that we as group, as well as the industry, we've been expecting for some time now. I really like what Victor said right before me, that for the BPO industry, for us, day one of the ECQ was really when we had to hit the ground running. But I think to a certain extent, we've been expecting this. Since the mid of last year, we've been expecting that there would be a bigger shift into the digital space, and then there would be more automated tools coming into play. What we didn't know, however, was how soon we would have to make that happen and how soon the transition would take place. So really what happened is one day we were all in the brick and mortar space, and then the next day we all had to transition into the digital space. And I think that was a big shift for operations, be it L&D, be it hiring or HR or just regular operations. So we've really worked hard with our partners in various industries, in healthcare, of course, as well as finance and other telco, some telco as well. What we did, some strategies that we put in place for us to support our partners as well as our organization to make that digital transformation and to manage that sudden change was we reimagined the entire L&D as well as hiring process, coming up with digital frameworks. I think it goes hand in hand a lot with infrastructure, having the right bandwidth, having the right infrastructure, having the right equipment. So coming into the physical part of things, being digitally ready. So we created a framework from a hiring standpoint as well as from an L&D standpoint, looking into areas where we could automate, simplify processes and leverage on tools and technologies that we currently have. We've so far done we've taken up multiple projects and initiatives in the virtual space, including virtual job fairs, training events. We've been having a lot of virtual training caravans as well as free webinars that we've been offering to support the industry because we realize that the shift from the brick and mortar space into the digital space comes with its own set of challenges, especially for managers and leaders in terms of being productive and coming up with the right and understanding how we can meet our KPIs. So I think these are some things that we've been working with in ensuring that leaders are able to keep up the engagement with their teams. It's a hard time. It's a difficult time for all of us, given the uncertainty that we are going through today. So from a leadership standpoint, from a management standpoint, what are some of the tools and techniques that we can use to ensure that engagement is there with our teams? And we've also really tried to equip our workforce for the remote space, helping them in terms of understanding technology better, facilitating through a remote setting, coaching through a remote setting. We also have a lot of assessments that our recruitment teams use. So we really enabled it from an app standpoint. We ensure that all the people who are taking these assessments could access it via apps that they could download on their mobile phone. So we enabled it on a mobile standpoint as well as from a web standpoint. So I think if I had to summarize it, it would be from a 3P. We looked into the physical side of things, being digitally ready. We looked into the people side of things, as well as from a performance standpoint, how can leaders ensure that the KPIs are being met, as well as the productivity is at par, or at least close, maybe not at par yet, but at least close to what it would have been in the workplace. So I'm not sure if that really answers your question, but I think these are some of the initiatives that we've been trying to by recreating the digital framework.
Oh no, well said, Shannon. Thank you. As part of the learning process, it's collaborating with others and
Agreed.
enriching the learning experience. Can you tell me how this can be achieved using new digital models?
That's really a great question, and I've just been having this conversation yesterday with one of my colleagues and one of our partners, where they were really transitioning the classroom training into a remote setting and engagement, having a positive experience in terms of learning outcomes, and then ensuring that there is proper ROI. So I think a lot of it comes into the tools that we use. The digital space really, a lot of us might still be coming to terms with the tools, but there are applications and there are gamified models which can be used in a blended scenario. So what we've been seeing is that the industry still likes the live training model. In other words, our clients as well as our partners have been interested in having a trainer actually present with the learners, even if it is virtually. And from an engagement standpoint and conducting of activities standpoint, it's really, of course, to be straightforward here, we would not be able to have all the activities that we would have in a classroom setting, but there are ways we can break out into little groups, we can have engagement activities, even during the training, and then ensure that there's a positive learning experience. So we've been doing that, not only from a leadership and an L&D standpoint, but also supporting the future set of frontliners in the medical industry. So we've also transferred our medical coding and medical billing in partnership with AAPC. We've transferred that into a digital space as well, where we have blended the approach. So we have e-learning modules, which is supported by live training. So we've seen that so far that works well. The e-learning modules work as a pre-work, or it works more as a way for our learners to practice whatever they're getting in the live session. So that's really been one of the approaches that we've been taking.
Thank you, Shama. While we're talking about the e-learning process, there's one other question that I'd like you to address.
Sure.
Will the new e-learning models require more time to achieve the same results as classroom-based training? One, and number two, will the trainers have to recalibrate themselves and learn new skills to adapt their course material for the new normal?
That's actually a good question. To be honest, for e-learning, the biggest challenge is engagement. What we've seen with most of the platforms, be it the bigger ones or maybe even platforms that we have internally, engagement is a challenge. However, one tool or one method that ensures that there's greater engagement with the e-learning modules would be bundling it with live training. And I think another way that we could go about it would be from a e-learning standpoint, having it gamified. That allows for more engagement. It allows for more practice time. From a retention standpoint, I would always recommend for the learners to have a coach, for them to have someone to guide them through the process, because especially when you're learning a new skill, it's hard to get lost. It's hard to get stuck in one. It's easy to get stuck in one area. So for them to be able to navigate that piece, I think it's important for the e-learning piece to be bundled with a trainer or a coach, at least for better retention and for better effectiveness. From an equipment of a trainer standpoint, a retooling of a trainer standpoint, I think there are a lot of automated assessments that these trainers can take into consideration. But apart from that, I think, yes, I would say yes, the way that we facilitate a classroom training is kind of different from the way that a virtual session is handled. So there would be some shifts in the way that the trainers would have to familiarize themselves with the technology, familiarize themselves to a certain extent with the way or methodologies when it comes to online training. So I think, yes, there would be some additional support that we would have to provide to our training teams and our learning teams in terms of retooling and re-equipping not only our training teams but also our leaders, because even supervisors and managers act as coaches sometimes, and we are looking at a possibility where some of the leaders might not even see their team members for months at a time. There might be new teams where for companies who are choosing to go to work from home completely, where they would never meet their team members. So I think not only from a training standpoint, but also from a leadership and from a supervisory standpoint, that is a big paradigm shift. There would be a big shift in the mindset, the way that we do things. So I think there would be some retooling as well as some new ways of working that we might want to bring into the picture.
So, do you think, Shama, that the Philippine learner or Filipino learner would now be capable of handling 100% basic online without being handheld through the training course? Because it's different, when you have the U.S. setting, learners there are pretty independent. But
Yep.
as for, the Philippine setting, it's more hand-holding. So my take is this: would a 2-week, for example, training program be equivalent online as opposed to face in terms of getting the learning objectives achieved?
So one thing that we've been noticing is in the classroom training, it's more on full day trainings, but when it's virtual, then it has to be shorter. So maybe 2 hours or 3 hours or 4 hours kind of sessions, because at that time you're really getting a lot of content out there. It's really compressed. So if you're looking at a 2-week training time, we've been doing a lot of virtual sessions for new employee onboarding, for hiring, for recruitment events. However, what we've seen is that the people's attention span is a bit shorter in the virtual setting rather than the classroom setting. So in that kind of a scenario, we might have to spread it out into longer time frames, and then there has to be some sort of a progressive check-in with them from a 30, 60, 90 days standpoint. So it can't be, I think when it comes to e-learning and when it comes to the digital space, it really has to be combined with a progressive approach. So that's really my take on it. And then from a tool standpoint, I think at this point we really should leverage on all available, at least try around all kinds of technologies that we can take advantage of. I know there are a lot of cognitive assessments, a lot of assessments based on skills. So for us to be able to give the right solutions, we would have to do the proper TNA, needs analysis. So at that point, we can really leverage on automated assessments to analyze the skills as well as the behavioral components of our people. And I think based on that, if you can create targeted training programs, I think it could be even more effective than the classroom training. Because at the end of the day, from a learning standpoint, the more comfortable the person is, the better, or the barriers to learning is a bit lower, so more information goes in. So I think from that standpoint, we would be able to bring in more learners into the digital space.
Okay, terrific, Shama. Thanks a lot. Okay, now I think we have a lot of specific time for Q&A, and I see that there's a lot of questions coming in, and this is the time when we open up the floor for our audience, our participants, to feel free to ask questions. Rather than me reading some of these, perhaps. Some of you would like, to address your questions directly to any of our panelists. The floor is now open. Okay. Yeah, go ahead, please. Feel free. Go ahead.
May I go first?
Yes, is that Michael?
Yeah, it's me.
Yeah, Michael. How are you? Haven't seen you for a long time. Yeah, but I recognize that voice.
Thank
Yes,
you
go
for
ahead.
here. I have a question for PLDT. It's more of a concern from our members, our fellow members, that have been trying to do work from home arrangements in certain countryside cities, namely Davao, Iloilo, and even Bacolod. When they try to transition to work from home using LTE SOHO routers, about 70 to 80% of them could not find enough bandwidth or enough signal strength to be able to work from home. Now, obviously, that will have been determined by how far away they are from towers or central nodes. But what would you suggest for companies like smaller companies like them to transition to work from home, given that their employees live in places where there's probably not enough signal strength or available bandwidth?
Victor, please go ahead. Victor.
Oh, sorry about that. My mic was on mute.
Oh, okay. Oh,
Sorry.
mute. Go ahead, please.
Michael, which company are you representing, if you don't mind me asking?
Oh, sorry. So I'm with NICT. We're the National ICT Confederation of the Philippines. So we have 81 councils around the nation, and we work with LGUs and we link up with industry to help them kind of, through this, for example, these times of crisis, for example.
Great. No, I appreciate your question. I understand, there are areas of concern within some of the provincial places that you had mentioned. To be honest with you, what we're trying to do is gather that data, get the voice of the customer, so we can be better prepared to invest more equipment within those specific areas, and we can be strategic on our spending and our infrastructure upgrades. If you could kindly liaise with me offline, I'll give you my email address, or you can get it through Raymond or anybody at HIMAP. We'd be happy to understand your concerns further, and then we'll send you more information on what we're doing within those areas. But yes, again, we are challenged in some particular areas, and we just have to spend more and work towards getting our infra out to those places.
Okay, thanks. Just in case we do connect, what could I say to our members to see if you guys will try to fix something? Do you have a lead time in mind on how soon it can happen?
Sure. Now it depends on the area, as well as if it's under ECQ or GCQ. But we're getting more and more field representatives being able to move more freely. It might take a little bit longer for the home services because they don't have as much leeway right now as some of the enterprise field representatives do. So if it's a home consumer or retail line, it might take a little bit longer as opposed to a enterprise consumer. I'm sorry, enterprise account.
So what would be a good number to say? Like, could I say a week, 2 weeks, a month?
I would say, so what we're doing for enterprise, for provisioning, you're looking to 5 to 7 days, and I can't speak on behalf of the other lines of business just because I don't have the oversight there.
Okay.
And I don't want to overpromise and underdeliver. So,
Right. No, understandable. Well, okay. I mean, at least 5 to 7 days will give us more or less an idea. Hopefully for home services, double that at most. But yeah, okay. Thank you.
thank you very much, Michael.
Victor, Danny Cuevas, right?
Yeah, Danny, go ahead. Yeah.
Hi, Danny.
The first of all, to the question of Michael, is that a PLDT problem or is just really bandwidth issue in the location for all carriers?
Now, in terms of bandwidth, now I saw your question earlier. I saw it on the typed in questions. You mentioned, if I may read back, said, what is the current utilization of capacity in delivering bandwidth for work from home? Fortunately, we're way below threshold. So we upgraded significantly and continue to do so. Based on our last update, we've kind of accelerated our typical process for expansion within this year prior to COVID, because we were kind of anticipating some of the work from home boosts. But there's been significant upgrades on international IP capacity, cache domestic backbone, and the broadband nodes. Now, for those particular areas, I don't have oversight on the exact locations, so I can't make a statement regarding what's affecting those. But generally speaking, I don't think it's overutilization of bandwidth. It just might be that the areas are far flung from where the cell towers may be.
Right, absolutely. Victor, the challenge to this is if it's actually infrastructure, because obviously if you don't have signal there, you have to improve your infrastructure there, right? Isn't there a freeze on capital expenditure for PLDT?
I'm sorry?
There was an article that they're freezing expenditure, capex expenditure for PLDT.
That's correct. But prior to that, leading up to everything, again, we've invested. Last year alone was around 60 billion in capex. So we're doing what we can for now, and then we'll reevaluate again once things have settled regarding the whole pandemic and global financial crisis.
Right. Okay.
Okay, good.
Sure.
Very good. Yeah. I think, if we have other questions, for our other panelists, we have Rodmar and we have Shama.
Raymond, I have a question for you.
Standing by.
Raymond,
Who's
can I
this?
ask a question? Danny.
Danny, yeah, go ahead.
Right. There was an article recently that the Philippines, I posted it, is now down to number 3 as the preferred destination for outsourcing. Did you see that?
Okay.
Number
yeah,
one.
I kind of noticed that. No, but I think India's always been number 1. They've been ahead of us for a long time. Now you asked about South Africa.
No, the article said
being ahead of the Philippines.
Sorry, Raymond. The article said that Philippines was number 1, 2018, 2019.
In voice. You're talking about voice, right?
Preferred destination for outsourcing in general.
Well,
preferred.
Yeah. Okay.
And then they said that the Philippines now is down to number 3.
Okay.
So,
and who's number 2?
South Africa. I
South
didn't mean it that I'm laughing. But South Africa is number 2. And Malaysia is number 4.
I guess, Sir Raymond, we just have to confirm on that, Sir Danny. So we don't really have the answer to that question. So thank you very much for that question. Yes, we do have a question for Sir Rodmar. Question is, will the PCRP members be doing their work differently post ECQ, GCQ? If so, what will it be? That's for Sir Rodmar.
Okay, I think the biggest challenge is for our members who manage trials. They visit hospitals where the trials are being done to see how are they going. So I think one of the things that the guidance that we came up is to decrease the number of physical visits to hospital and to be able to transform this remotely, be able to do this remotely. So that's one. If you want to ask about how about the second would be to be able to, if visits are necessary and cannot be avoided, then protective measures must be undertaken by companies. For example, wearing PPEs when they go to hospitals and talk to the doctors who are doing trials, check at data that comes from patient charts, for example. So basically, that's the biggest challenge that we have in terms of our employees in this sector. It goes the same for patients who are enrolled in trials. There should be protection now if they go to hospitals and for visits, and to be able to transform some of those visits into remote visits. So that's the keyword there is doing things remotely.
All right, thank you very much for that. Back to you, Sir Raymond.
Okay, the floor is still open. As a matter of fact, for questions, I see, a lot of our participants, in the in the call. So please feel free. I see Chris of Aon, Butch Valenzuela. You're also in, so please feel free to ask any questions to our panelists.
So Raymond, I gathered one more question here from Ms. Judy. What is the advantage of having an automated assessment, and how the candidates' behavior in taking the test? I think that goes for Ms. Shama.
Thank you very much for that question. Yes, I think like we were discussing earlier, that having or reimagining the hiring process and using digital tools can really ensure that we can work with volumes, as well as I think from a hiring and a recruitment standpoint, having automated tools ensures that we can get the right candidates for the profile. So that entire profiling process, I think, can be made a lot faster if you're using automated tools, especially from a behavioral standpoint as well as from a cognitive standpoint. So I think from a fitment and finding the right candidates, the right competencies for that role. Yeah, I think assessments, automated assessments, especially for remote hiring, for companies that are hiring remotely, that can really help.
Okay.
Okay.
And just a follow-up question,
Yeah.
Sir Raymond.
I'll read it. No problem.
Just go ahead.
Yeah, this
please.
is the question addressed to Sham as well, no?
Yes.
From Roger. Will training duration take longer in the new normal? And what learning tools will be stressed? Shama?
Yeah, sure. So from a training duration standpoint, I think it's again coming up with hiring the right talent and marrying that with the right kind of trainings that is required for them to gain the right skills as well as meet their operational KPIs. So at that point, maybe some of the trainings that managers or leaders can consider would be behavioral trainings, especially right now after the ECQ is lifted and then we are getting into the new normal. There might be some that would be on mental health, on emotional intelligence, and then to see that when they're coming back to work, how ready are they to ensure that they're able to cope up with this kind of a scenario. So I think from a duration standpoint, as well as from it comes back to picking the right kind of training and then looking at what our objectives are and how can we marry the entire flow of getting the right talent, getting the behavioral assessments there, getting that report, feeding it into the training process, and then building the right training program that would ensure that they would be able to meet operational KPIs. So just streamlining that process, I would say, would ensure that the training process itself is not too long, it's optimal as per the business requirement. So I think using, again, online assessments or having virtual interviews as well as virtual training, using various platforms, we can leverage on minimizing the time. I don't think the training duration itself would be longer, but I think what we need to focus on is making it more effective using these virtual tools.
Okay, thank you. As a follow-up question again, because we've been talking a lot about training. Has to do with recruitment. The other aspect that that's important. In your process. Question is, what can you recommend for process in recruiting new employees? For hiring, how do we go about background checks? And that can be continuous, the same background checks that we're doing, but more importantly, submission of requirements for new hires. Can you give that a shot?
So what we're doing, sure, of course. So we have a framework that I mentioned earlier on reimagining the hiring process. So where we have digitized the candidate application process, starting from LinkedIn posts or Facebook posts, these employees can directly schedule interviews with the recruiters, and then using virtual screening processes where at least the first line of interviews, which was done by recruiters before, can be done using video-based technology. So that way the virtual screening process is much faster. And then combined with digital assessments, I know that there are a lot of, I know since we are part of the IT-BPO industry, a lot of us use English proficiency assessments in the writing space as well as the communication space like Versant. So these digital assessments can be transferred from the telephonic or IVR-based assessments into more app-based, AI-based, using online mediums. So again, starting from number 1, digital candidate applications, number 2, virtual screening, number 3 would be digital assessments, using digital assessments, number 4 would be online interviews, because even if we are using videos for the first line of interviews, there would still be second and third rounds with the hiring manager, with the HR. So I think we can use some of these assessments as well as some of these video technologies to eliminate 1 or 2 rounds and shorten the workflow. And the last point, which is also I think the most critical point, and to come back to your question on documentation. So I think this is something that has to be worked with closely with the IT team. There are technologies and tools in place where remote documentation can be enabled. This really depends on organization to organization. You would have to coordinate with your legal team, with your HR team, to ensure that the documents that you are collecting has to be stored in the right way. Data security and all of those items have to be taken into consideration. So these are processes and steps that we are currently recommending, and these are things that we have been implementing in our own organization as well, using a lot of virtual interviews and online assessments.
Thank you, Shama. Yeah, at this point, I think would like to thank Victor Aliwalas. He has to leave, and attend to another conference. So, Victor, thanks a lot for joining us in this session.
Thank you, everybody. I appreciate it, and best of luck to everybody in the industry. And stay safe. Thank you so much, everybody.
Thank you, Victor.
Thanks, Victor. Yeah.
Okay. Question from the floor to address to Shama. I'll just read this off. Can we suggest topics for training we should do post ECQ? Most of the workforce are coming back to work, and we want to make sure that they are physically and mentally prepared. This is from Nicholas Reyes.
Thank you, Nicholas, for that question. Yes, I think that's a very relevant question. Number 1, I would say, would be based on emotional well-being. So there are, again, I keep going back to a lot of automated tools because I'm a big fan of technology and I like using technology as much as I can. So I think as a manager, as a team leader, we would have to ensure that there is emotional readiness among our people. I can leverage on automated assessments in terms of getting benchmark on where they're at. But even apart from automated assessments, I think the personal touch is very important. As a leader, ensuring that we provide them with the right tools to build resilience, to build that emotional intelligence so that they can cope up with the new work scenario. So that would be one, emotional intelligence. I think another one that you might want to consider would be to equip your leaders as well as your people in terms of time management and productivity, because working in the remote space is different from working in the office space. So how to manage that time, how to ensure that we are productive, how would managers ensure that the KPIs are being met. So from an enablement standpoint, enabling the people as well as the leaders with that skill set. So I think these two, apart from that, any hard skills or any technical skills that would be needed for them to ensure that they're able to come back, into the workforce fully equipped. I know that some countries in Europe, like France and Germany and some other countries, are really focusing on, even the government is supporting in terms of upskilling of their people, leveraging on a lot of the free time that people have during the ECQ. So I think the next couple of days, I think that would be definitely a part of the agenda. And then moving forward, where June, I think June to July up till November would be peak time for us to get back to work. So prior to that, ensuring that we are equipped to handle that workload and handle that upcoming stress that is going to be a part of our lives.
Okay, thank you. We have about we have a few minutes more, about 10 minutes, to handle any more questions, from the floor. Well, there's another one here. I'm just going to read this address to Rodmar. Given all the PCRP members, how do you keep your teams engaged? Can you share some best practices used at PCRP?
Okay,
Rodman?
I think the easiest answer would be using Zoom. Anyway, as an organization, initially in March we have cascaded a guidance for all our members to use. I think one of the biggest challenges for our members is to be able to gather all of that information that's happening in all of the hospitals that they are conducting trials with, gathering information not just in hospitals, even in how couriers are working, how logistic providers are working, how is government working, and so on and so forth, and to be able to process this information and to be able to get an idea of how they will have continuity with all of the trials that they're running, the projects. So, and to be able to cascade this to their headquarters globally, to the project managers of the trials globally. So I think that's one of the things that we are looking at, and there should be a good interface between managers to be able to guide our members into processing this data, and guidance also from our organization to be able to do that. In terms of getting them engaged, I think most of us are working at home, so we use Zoom to do it. Yeah. Unfortunately, there is no structured learning that companies can provide to be able to do this data processing all of this information and ensuring that there's continuity of their projects. Yeah.
Okay, Robert, thank you. Just for our basic understanding, how much business clinical trials are being done locally by you guys as opposed to trials coming in from your clients abroad? Would there be a specific percentage of that?
I don't
in
have.
terms of
In terms of the business, I don't have the figures. In terms of the number, I don't have with me right now. But what I do know, I can give you quickly right now. In Southeast Asia, in terms of the volume of trials that are coming in, number one would be Singapore. Number two would be Malaysia. Number three would be Thailand. Number four would be Philippines. So we're the fourth in terms of receiving volume of trials in Southeast Asia. In terms of globally, we're not even 10%. We're not even getting, if you look at the number of trials globally, we're not even getting 10%. We're getting less than 1% of all the trials being run globally. As you can see, there's a huge competition among countries to get these trials in their respective countries. And a lot of our competitors are very fierce. They would still go to countries that are very, very reliable. In Asia, for example, they would still go to Australia, they would go to Japan, they would go to China, of course. Everyone would go to China and would go to South Korea. One of our advocacies is to be able to make the Philippines an attractive country for trials to come in. Yeah. Yes.
Okay, sorry. All right. So no, thanks for that perspective. I think with the clinical background of our labor force here and the exposure that we have, I think there should be more business coming in to the Philippines in the near future.
Yes.
One other question that was sent over to me is will the PCRP members be doing their work differently post ECQ? If so, how differently will it be?
I think I answered that.
I think you did.
Yeah, I did.
Yeah.
The keyword there is remote, doing things remotely and combining it with technology. That's one thing that I forgot. Yeah.
Technology, yeah, okay, yeah. Well, we talked about AI and analytics and robotics and all of that a while ago. Okay, that's good. So I think we've covered a lot of grounds today with Q&A. We have a few more minutes actually. Sorry, we have a few more minutes to take in maybe a couple of questions. Anybody from the audience would like to come up with the query? Okay, go ahead, please. Okay. So
may I talk a bit?
Yes, please. This is Rodmar.
Okay, I think everyone has the mindset that a vaccine will be available very soon, but to give you a perspective on how vaccines are developed, it takes around 10 years in the normal circumstances to develop a vaccine from concept down to having the vaccine at a drugstore. It costs around $1 billion to do it. And there's a lot of failures. We have a lot of failures in terms of vaccine development. As you can see, we don't have a vaccine yet for HIV. We don't have a vaccine yet, a full vaccine for the flu, because there's a lot of strains. We don't have a full vaccine for dengue. So there's still a possibility that the vaccine development will be delayed for COVID. And there's also a possibility that a vaccine might not be available at all in a few years. So I think we need to work with that mindset. But these are extraordinary circumstances, and pharma companies are being pushed the limit with the help of governments to bring that vaccine faster than they would normally would. That's all.
So are you saying, Rodmar, that is it feasible that we would have a vaccine, as a lot of people are talking about, April of next year, by 2021? That the vaccine should already be in place?
Yeah, I think it's more of we're all preparing for our business continuity with a vaccine in mind. We should also prepare for a BCP without the vaccine in mind, because it's possible that there will be no vaccine in April. It's also possible that there will be no vaccine in 2020. These are all possibilities. But of course, I'm very hopeful with the push from governments to have this vaccine. Hopefully, we can have it faster. But of course, we should always plan for another eventuality, which is having no vaccine at all. Yeah.
I see. Okay. All right. Very good. Okay. So I think we've reached, our point of turning over the floor for our closing remarks. Judy, would you be in a position to deliver that closing remarks, for our audience today?
So thank you, Raymond. First of all, thank you for our guest panelists, Rodmar, Victor, and Shama, in sharing their insights and very informative and relevant topics in relation to going back to report to work and facing the new normal. So as Rodmar mentioned, it seems that there's lots of opportunities for the Philippines. I like what he said, that their advocacy is to attract more investors or companies to use the Philippines as their site for clinical trials. And it is also good that if the Philippines will be chosen to be one of the sites to do the COVID trials. But I'm kind of scared when he also mentioned earlier that in developing the vaccine, it will take years, 10 years. So I think for the leaders and organization, we really need to prepare ourselves. Let's be calm and try to come up with that worst scenario, okay? So, and also in Rodmar's talk, he also mentioned about technology. They've been using technology, they've been using AI to manage the trials and even the data analytics. So it seems that technology and innovation is really will play a critical role in this COVID-19 lockdown, even post-COVID. It seems that the new normal really talks about technology, infrastructure stability, digitalization, mobile application, and various channels that we can make use of, not only for the operations, but also for other requirements in terms of learning, recruitment, sourcing, and assessment. So like what Shama said, they created a framework in order for them to support various companies in terms of how they can transition from a face-to-face classroom training to a virtual training combined with an online assessment for them to be able to assess the behavior using mobile applications and using other platforms. And I'm sure there's lots of available applications and platforms that's being offered by the other companies. I think the great thing here is that there's a positivity in terms of how the companies or the candidates are taking it. It seems that they're welcoming the automation, they're welcoming the digitalization. And the 3Ps is very good to look at, looking at the people, the transformation of the people, the transition, the performance, and the productivity monitoring. So having said that, both technology and application, we really need to have the support of the telco companies like PLDT and the other telco companies. I'm very thankful that from day zero, PLDT already have this initiative to really support the IT BPM industry. Without the telco, without the right connectivity, I don't think organizations will be successful to transition from a work on site to a work from home. And we really need to be collaborative. We need to be open to suggestions. We have to coordinate and provide them more information on how they will be able to support the organization. Although they already have this, they've been investing on bandwidth, they're investing on increasing or revamping some of the infrastructure. Collaboration is really required at this point. So I thank you for attending, for all the participants, and thank you for, as I mentioned, thank you for the panelists. The last thing that I can say to you at this point is, number one, for us to be successful during COVID lockdown and after COVID lockdown, we have to understand the industry market demand. Where is the healthcare's growth right now, the healthcare industry? What are the opportunities that we can look at? Of course, we have to consider the environment. We have to consider the employees' behavior and how we can develop and enhance them while under pressured working from home. We can also leverage the availability of all the tools and technology in the market. And of course, at the end of the day, we have to comply on all the government regulations, and hope and I wish that the government will give us a clear guidelines, because sometimes with too many guidelines, there's different interpretations. So it's up to us now as individual and as organization to work closely and come up with a clearer guidelines for the industry. So for that, thank you very much. And we look forward to see you again next week, May 22. We're going to have our 7th session. This time we'll be talking about the landscape of the real estate. as well as HR best practices post-COVID. So thank you and be safe. Thank you, everyone.
Thank you. Thank you.
Okay, thank you, everybody,
Bye.
for participating, and thank you, most especially to our panelists.